guys, this is Dr. Hub. Today we'll look at the responsibilities. So the responsibility of the health workers. So to begin with, first we look at the female health workers. So the female health workers, it includes the maternal and child health services. So there's maternal as well as the child. And this is the health services. Next is, it includes the family planning services and it includes the family planning services as well as the registers. Next, it includes the MTP, that is a medical termination of the pregnancy. There are also the universal immunization program. Then there is also the detection of the non-communicable diseases, detecting the non-communicable diseases, and there is also the dye training which is done. Next is, what are the other functions of the female health workers? It includes the treatment of minor ailments. So you treat the minor ailments. And there is also to participate. So there is participation. So participate in the team activities also. Now we move on to the male health workers. So in terms of male health workers, what are the functions? So male health workers, it includes the national health programs. So there is the national health programs, and there is also the malaria slides and surveillance. There is malaria slides as well as the surveillance. Next comes the leprosy follow-up. There is a leprosy follow-up, and it also includes the identification and follow-up of the blindness. So the identify plus the follow-up is a follow-up of the blindness. Then the reproductive and child health services as well as the child health services. Then the RNTCP. Next, there is also the expanded immunization program. The expanded immunization program. Then comes the environmental sanitation. So there is environmental sanitation, and this includes the chlorination of water. So it includes the chlorination, this is of the water, and also the proper waste disposal. Now let's look at some common responsibilities. The common responsibilities, it includes, there is nutrition. Next, there is distribution of contraceptives. And there is also the work on communicable diseases. So work on the communicable diseases, and this includes the DOTS activities. Then there is to record and report the vital events. So you record and report the vital events. And also there is record keeping and maintaining the registers. There is record and maintain the registers.